Hello again. Now, an update on the measles outbreak. 8 more cases have been confirmed in the last few weeks. Since October last year, nearly 1,000 measles cases have been recorded in different parts of our country. An outbreak of the virus has now been confirmed in all the provinces except the Eastern Cape. Children between the ages of 5 and 9 have made up the largest affected cohort. Let's get the latest now from Dr. Kerrigan McCarthy, a pathologist from the Center for Vaccines and Immunology at the National Institute for Communicable Diseases, that's the NICD. Doc, good afternoon. Welcome to today, and thank you very much for your time. Let's just begin with an overriding question first. What are the numbers looking like in terms of measles? Are we still just below 1,000?
You're spot on there, Dan. The NICD released a situation report as of the 24th of April, and to date, 976 cases of measles have been identified across the country, with only 8 cases identified in the last week. And if we take a close-up look, the trajectory of the measles outbreak is downward. There are fewer samples being submitted daily for testing, and there are fewer samples that are testing positive. And if we look and do some mathematics, as supported by the South African Centre for Epidemiological Modelling and Analysis, the reproductive number, that is the number of secondary cases that follows on from each single case of measles, is decreasing. And there's a number of reasons for this. The one is most undoubtedly the national vaccination campaign that has been conducted by provinces for children aged between 1 and 15 years of age. The second reason is probably the outbreak itself. Measles is what we call an immunizing infection, and if you've had measles once, you won't get it again. So what happens is that an outbreak sweeps through a population, and people get measles, recover, and then they can't get measles again, and the outbreak naturally dies out. Yeah. So it's a good news story for the day. The measles outbreak is waning. It's on the way down.
That's definitely good news, because at the beginning of the academic year, I mean, many provinces, especially in Limpopo, they were even on the roads, the MEC telling people to please get their kids to be vaccinated against measles. So it's waning, it's slowing down because of this large-scale immunization, as you say, and population immunity. What was driving this measles outbreak? Do you have a sense from your data, Doc? Is it because people move? I mean, people go across borders and people are very mobile, especially during the festive season.
Yes, it's absolutely clear what the reason for the outbreak was, and it was under immunization in our population. So if we have a look at the age range of patients who came down with measles, the largest age group was in the 5 to 9 year age category, and this was followed by the 1 to 5 year old age category, and then the 10 to 15 year age category. And this corresponds with the number of years that have elapsed since the previous large outbreak in 2009 to 2011, when we had over 22,000 cases. What happened was, in that outbreak, measles swept through the population, infecting everybody who wasn't vaccinated, and that left people in the last 15 years who have not received measles vaccination. It left them vulnerable to measles virus. And so when the number of people in our context across the different provinces reached a sufficient threshold, and measles was introduced as it was from north of our borders, the virus swept across the population and is still causing a number of cases, particularly in Limpopo, where we are seeing residual cases, because the Limpopo Department of Health initially only vaccinated children aged 1 to 5, and it was a number of weeks before Limpopo expanded the immunization campaign to children under the age of 15 years. The wide age range of the campaign allowed the mop-up of those children who had missed measles vaccination to be vaccinated, and hence it's allowed the outbreak to tail.
Yeah, big lesson there for health practitioners and the National Health Department. You can't not promote awareness around the need for measles vaccinations, especially for children, and other appropriate vaccinations. Can you tell us if you know why the Eastern Cape was largely spared from this outbreak? As I read in my intro, we saw many more cases in Limpopo, in Mpumalanga, here in Gauteng, but the Eastern Cape, I don't know if they were properly immunized. I mean, what could it be? Do you have a sense?
We can make hypotheses and conjectures as to what the reason is. The outbreak was largely confined to the northern parts of the country. So even though there were few cases in Eastern Cape, there were also very few cases in Western Cape, Northern Cape, and fewer in Free State and KwaZulu-Natal. And one of the reasons for this is likely that by the time the outbreak spread down south, the districts in these provinces had already started with their vaccination campaigns. And this therefore prevented large-scale outbreaks. One of the other reasons is perhaps underreporting. So measles can, in some cases, be a mild infection, and if one has limited access to healthcare and you see your child is not drastically ill, a person is unlikely to take their child for measles testing. And furthermore, in outlying clinics, it may be harder to access diagnostic testing. So it's not surprising that the more rural and less densely populated provinces should report fewer cases when there are in fact only limited numbers of cases in those.
Yeah, Doctor, as we conclude, I just want to get your sense as a scientist in this field, and I don't want to put words into your mouth. I've sort of expressed myself about what these are big lessons here. What would you like to see as an NICD happen to avoid another outbreak of measles?
Lovely question, Dan. Measles is on the global elimination agenda for 2030. And in order to do this, we have to achieve at least 95% vaccination coverage in South Africa and Southern Africa. And this is a target that is easily reachable. There is very good evidence that measles is, in fact, an eliminatable disease, much like smallpox was. And if we are able to reach these vaccination rates, we can eliminate measles. And this would be an immense cost saving for our country, and not to mention many years of life gained and happiness in terms of familial comfort and free from stress of illness. So, a big thank you to the parents who've allowed and caregivers who've allowed their kids to be vaccinated, who've sought out vaccination. An enormous word of thanks to the district and provincial health departments for mounting a massive immunization campaign. But a plea to parents of current and future generations to get your children vaccinated. Do not hesitate. It's never too late to vaccinate. Keep up your commitment to the vaccination program.
Dr. Kerrigan McCarthy, thank you very much for your time and insights. At least you brought us the good news this afternoon, that the measles outbreak is now no longer, it's beginning to wane. That's the word that you use. That's good news. And hopefully the message is out there clearly. Please go and vaccinate your child, especially the younger ones. There's a lot of work to be done by the MECs for Health in the provinces, as well as the National Department of Health under Dr. Joe Phaahla. Thank you very much, Dr. Kerrigan McCarthy from the NICD.